we are in the middle of one of the worst public health crises this country has ever seen.
And, you know, getting death threats from me and my family and harassing my daughters to the point where I have to get security is just, I mean, it's amazing. I wouldn't have imagined in my wildest dreams that people who object to things that are pure public health principles are so set against it and don't like what you and I say.
A virus 1,000 times smaller than a dust mote has humbled and humiliated the planet's most powerful nation.
We put together a pandemic preparedness plan as we were trying to respond to the threat of the pre-pandemic bird flu back in 2005. And again, it was a plan that was a reasonable plan. And in fact, when it was evaluated independently by Johns Hopkins, it stated that it was our preparedness for a pandemic was essentially #1 in the world. But what happened when the rubber hit the road on this, and we did get hit, we had the kind of response that was not as well suited to what the dynamics of this outbreak is. And what happened is that we had a bit of a disparate response. We live in a very big country, and we often leave the decisions about the implementation of things at the local level. And what we've seen is a great disparity in how individual states, cities, et cetera, responded. We decided we would try to take steps to open. And when we did, we didn't do it uniformly. Some states did not pay attention to the benchmarks or the checkpoints. Others did it fine, but the citizenry within a state or within a city actually did an all-in-one phenomenon. They said, we're locked down, so now we're just gonna let it fly. Now you could say, no, that didn't happen, but the numbers tell you what happened. Because what happened is that as we began to open, we went from 20,000 a day to 30, 40, 50, 60, and we even peaked at 70,000 new infections. The deaths had gone down nicely. That was good. Now they're starting to go up because of the cases that went up. So we had a disparate response. We didn't all row together.